Hey, it's Dr. Schick back again here today, and welcome back to my YouTube channel, where we continue to discuss anything and everything related to associate dentists. Today I wanted to uncover a very important topic in my life, and an important topic in many recently graduated associate dentists' life, and that's what I find to be the three biggest lies told to us graduating dentists. Number one, and the biggest lie told to all dentists in my opinion, is that dentists are rich. In 2023, the ADA released a study that said the average recently graduated dentist carries $330,000 of student loan debt. Additionally, the average income generated by a recently graduated dentist is just $157,000. That number just 2 years ago in 2021 was like $171,000. So over a 2-year time period, we've seen a reduction in dentist pay coupled with an always increasing student loan burden. This isn't to say that dentists can't be rich. This is just to say that you won't be rich initially if it's all based on you. When I graduated from dental school, I carried $330,000 of student loan debt. I didn't have a penny to my name. I felt like I was anything but rich. Here I am 3 years out of school. I have a nice nest egg. I've paid off all my high consumer debts. I'm still not rich, but I'm starting to do a lot better. Lie number two, you are an expert. I always hear from recently graduated docs, and I felt this for a good 6 to 12 months after graduation, but there's this sensation of imposter syndrome. You'll be reading a radiograph and you'll be kind of wanting to look around and ask people for some help. I know that when I was graduating, the mentor that I worked for initially was 12 years ahead of me in clinical practice. He knew far more than me. He had years and years and hundreds of thousands of reps under his belt. But to me, that was scary. I felt like I wasn't very good. I felt like I didn't know very much. I felt like I wasn't right to be there. All of those sensations are wrong. Just know that you do belong to be there. They call it a dental practice because you are practicing. You are getting better. So continue to practice. Know that clinical confidence comes with clinical competence. So as you continue to develop your clinical competence by taking on more procedures, you will eventually build confidence and the feeling of imposter syndrome will fade away. So the number three big lie that I'll hear is you don't need to do this. And the three main things that I've been told in my career that I found to be incorrect are, number one, people will say, you don't need to use a rubber dam when you're doing your root canal. Well, I was taught in dental school that it is illegal to do a root canal without a rubber dam. Additionally, if you explore the dental literature, there are numerous studies that show the safety benefits of using a rubber dam coupled with the improved outcomes when a rubber dam is used. So it's basically a double benefit. You're gonna not injure the patient, you're gonna help heal the tooth. So when someone tells you you don't need a rubber dam, they're lying. You do. Number two, this is something I'll hear all the time. Just give an antibiotic for that, or just give a steroid for that. Well, we know that there is a ton of antibiotic resistance out there. We know that dental providers are a huge contributor to the antibiotic resistance. So just because someone has a toothache isn't an opportunity to get them out of your office by throwing amoxicillin at them. Hold your ground. Antibiotics are for progressive swellings. They're not just because you have a toothache. So that's another thing. Number three, and this is a big one. I heard when I got out that when you do an extraction, you should give some opioid medicines. I was told things like, you'll be viewed as the non-nice doctor if you don't give opioids. Well, the person that was encouraging me to do this was giving 6 to 8 hydrocodones for single tooth extractions. Well, of course, when you compare me to him and I give you just Tylenol or ibuprofen, that seems like I'm not being nice. When in reality, I had to go through a lot of patient education and teaching that I don't want them to have an addiction problem the rest of their life. I would rather have them have a day of some tooth sensitivity followed with a lifetime of healing instead of being addicted. So just know that when you have these things that someone tells you one way that you know might not be right, stick to your guns and practice your way. Let me know what you think. Give me some comments in the area below, or feel free to direct message me on my Instagram at theeducatedassociate.com. I will get back to you. And as always, stay drilling, my friends.